Thank you, everybody, so much for being here with us today. Want to welcome you to the fourth episode in our Learn to Love Your EHR series. And today we're going to focus on advanced features and data quality, two of the key elements that transform EHR interactions from necessary into notably valuable. I'm Brian Masters. I'm a client manager here at Xpio Health, and I'm going to be your guide and lead troublemaker for today's session. In our previous sessions, we explored core functionalities and workflow optimization. Now we're going to discover how to leverage advanced features while ensuring data accuracy and reliability, and that's sure to inspire a little bit of EHR love. So join us as we uncover practical strategies that'll help your team get more from your EHR investment. And by the end of the session, you're going to have concrete tools to enhance both system performance and team satisfaction. Let's explore how these advanced capabilities can make your EHR a more effective partner in care delivery. In our last session, we explored the critical importance of streamlined workflows in enhancing the usability of EHR systems. We dug into some practical strategies that can help make EHRs more intuitive and efficient, ultimately benefiting both providers and patients. And today we're going to build on those insights by diving deeper into the advanced functionalities and essential roles of data quality in optimizing EHR systems. High-quality data is the backbone of effective EHR use, enabling better decision-making, improving patient outcomes, and ensuring regulatory compliance. We'll discuss strategies for maintaining data integrity and utilizing advanced EHR features to their full potential. But right now, let me introduce our panel of distinguished professionals who will be guiding us through today's session. First, we have Thaddeus Dickson. Thad is the founder and CEO of Xpio Health, and he brings more than 20 years of experience in behavioral health care. He holds numerous certifications related to healthcare security, privacy, and technology. And Thad is a recognized expert and frequent speaker on issues related to behavioral health technology and national health care. Thad has been traveling, and I'm happy to have him here with us today. Thank you, Thad. Next, we have Traci Crowder. Traci is our Chief Operating Officer, and Traci has an impressive 30 years of healthcare experience in various roles, including clinical, administrative, and consulting positions. Her expertise spans quality management, IT, risk management, and more. Traci is passionate about making a positive impact and helping clients and staff solve problems. And finally, we have Jill Johnson. She's our Director of EHR Services. And with more than 25 years in the behavioral health industry, Jill has deep knowledge of the billing and financial and technical aspects of operations. She oversees all EHR-related projects at Xpio, and she's an expert at integrating these systems into healthcare organizations' broader operations. We'll hear more from our team in a bit, but meanwhile, feel free to ask questions using the chat feature. We're going to address those questions during the designated Q&A session at the end of this webinar. And don't worry about taking notes, because we're going to provide a recording of this session to all attendees. So let's dig in. As we explore advanced EHR features today, keep in mind that the capabilities vary across platforms. Whether your system currently offers these tools or whether they're on your wish list, understanding advanced functionalities helps you envision what's possible for your organization and plan accordingly. Let's look at how these features enhance your workflows when they are available. AI and machine learning algorithms can analyze vast amounts of data to identify patterns and predict patient outcomes. These are technologies that can assist in diagnosing conditions earlier, personalizing treatment plans, and improving patient monitoring. For example, AI can flag abnormal test results or imaging studies and can alert clinicians to potential issues that need immediate attention. This proactive approach allows for early intervention, which can be crucial in preventing complications and in improving patient outcomes. AI also aids in administrative tasks, such as automating coding for billing, reducing errors, and saving time for healthcare providers. Telehealth capabilities integrated into EHR systems facilitate remote consultations, making healthcare more accessible. especially in underserved areas or rural areas. This integration ensures that telehealth visits are documented just as thoroughly as in-person visits. Patients can schedule virtual appointments and receive care in the comfort of their home and access their health records online, which enhances convenience and the continuity of care. Telehealth also supports mental health services, providing patients with timely access to counseling and therapy sessions. And moreover, telehealth integration can streamline workflows by reducing the need for in-person visits, freeing up time for healthcare providers to focus on more critical cases. Okay, clinical decision support, or CDS tools, provide clinicians with evidence-based guidelines and alerts during the care process. These tools can suggest potential diagnoses, recommend treatment options, and alert providers to possible drug interactions or allergies. By integrating CDS, healthcare providers can make more informed decisions, reduce the risk of errors, and improve patient outcomes. For instance, CDS can help in identifying patients who need vaccinations, screening tests, or follow-up care based on their health records. Clinical decision support also facilitates personalized medicine by suggesting treatments that are tailored to the genetic profile and health history of individual patients. We're going to talk more about clinical decision support later today. Predictive analytics. These use historical data to forecast future events, such as patient readmissions or disease outbreaks. This allows healthcare organizations to allocate resources more effectively and implement preventive measures. For example, predictive models can identify patients at high risk of readmission, enabling early intervention and personalized care plans. Predictive analytics can also help in the managing of chronic diseases by identifying patients who are likely to experience complications, allowing for timely adjustments in their treatment plans. Additionally, predictive analytics can improve hospital management by forecasting patient volumes and staffing needs and ensuring that resources are adequately allocated. So we see that EHR functionalities such as AI, telehealth, CDS, and predictive analytics can significantly enhance clinical efficiency in patient care. These tools enable healthcare providers to deliver more proactive, personalized, and efficient care. But right now, I want to stop to introduce you to somebody. Yeah, your boss is cool, but my boss is cooler. I want you to meet Traci Crowder. She's a powerhouse of expertise with more than 30 years of healthcare experience under her belt. Traci's done it all: clinical, administrative, and consulting roles across hospital, behavioral health, and primary care settings. She's led initiatives in quality management, IT, risk management, program development, and so much more. If there's a problem you need to solve, you really want Traci on your team. She always leaves things better than she found them. Traci brings the energy every time. She's bold, fearless, and always ready to tackle the next challenge. Welcome, Traci.
Wow, what an introduction. Thank you, Brian. And thank you, everyone, for being here with us today. I want to share with you a little bit of my lessons learned with EHR optimization, both at the system management level within an organization and at the Xpio consultant level, particularly as it relates to going beyond go live. So implementing these advanced features that Brian was just talking about, improving data quality so that you're fully adopting and fully utilizing your system. So as Brian mentioned, I'm COO at Xpio Health. I've been with Xpio for about 10 years. And before that, I was COO at a behavioral health agency where I had responsibility for implementing their first EHR, so going from paper to electronic records. And these topics that we're talking about today that Brian has described so well are common barriers to achieving operating efficiency and full adoption of an EHR. And they are a focus in our optimization work with our customers. What I found is we're all so driven to get to go live. And don't get me wrong, that's a heavy lift. It takes a lot of effort, and it's definitely a reason to celebrate. But here's the thing. Go live is just one milestone in the EHR journey. I think sometimes the most important work is done after go live. The fine tuning, the improvement work, that's for the long haul. One issue that surfaces pretty quickly after go live that that we see a lot is a concern about data quality in EHRs. A couple of major lessons learned are that achieving data quality requires some attention, and you can use some of the advanced EHR features that Brian mentioned to help, like AI and analytics. And even some not so advanced features like using available configuration rules to ensure data accuracy and completeness. For example, ensuring your data collection fields are in the required format, or enabling required fields or hard stops so that documentation can't be submitted if the data is not entered. We found that using advanced EHR features like incorporating AI and data analytics tools can help with data monitoring and data cleansing. You can quickly analyze and find missing or incorrect data elements. Other activities that we found beneficial that Brian will talk more about are establishing a data governance committee or process so that new configuration requests are vetted to make sure that you're maintaining standardization and efficiency, and also providing ongoing EHR training for staff relating to data collection that's embedded in their workflows. And hearing all of this information might be overwhelming. You might find it challenging to know where to start. The best place to start is taking note of the pain points that you're hearing about, those that impact billing, reporting, regulatory requirements, those that impact staff satisfaction and client care. And then identify the potential optimization solutions and develop a plan to test those and then implement. Thank you again for joining us today. And I wish you all the best on your optimization journey and hope that you reach out for help if you need it. Back to you, Brian.
Thank you, Traci. Okay, let's dig into the importance of data quality. Data quality is the cornerstone of effective EHR systems. High-quality data ensures that healthcare providers have the accurate, complete, and timely information they need to make informed decisions and provide the best possible care. And in this section, we're going to discuss the key components of data quality, common issues that can arise, and their impacts on patient care and healthcare operations. The basic components of data quality are simple: accuracy, completeness, consistency, and timeliness. Let's unpack them. Accuracy refers to the correctness of the data. Accurate data reflects the true state of the patient's health and medical history. Inaccuracies can arise from manual entry errors, outdated information, or miscommunication between healthcare providers. For example, if a patient's allergy information is inaccurately reported, it can lead to dangerous medication errors. Now, completeness means that all necessary information is recorded. Incomplete data leads to gaps in patient care and can hinder clinical decision-making. Every piece of relevant patient information, from medical history to current medications, must be documented. Incomplete data can result in misdiagnoses or treatment errors. For example, if a patient's previous surgical history is not recorded, it can affect future surgical planning and outcomes. Okay, consistency. Consistency ensures that data is the same across different parts of the EHR system and over time. Inconsistent data can cause confusion and lead to errors in patient care. Data must be entered in a standardized manner to maintain consistency. For example, inconsistencies in medication dosages recorded in different parts of the EHR can lead to incorrect dosing and adverse drug events. Now, timeliness means that the data is recorded and updated promptly. Delays in data entry can result in outdated information being used for patient care, which can have serious implications. For example, if lab results are not promptly entered into EHR, treatment decisions based on those results could be delayed, impacting patient outcomes. Okay, what are the most common data quality issues in EHRs? Well, manual data entry errors are a common issue that can compromise data accuracy. These errors occur due to mistyped information, misunderstanding of medical terminology, or simple human error. For example, a single-digit error in a lab result can lead to a misdiagnosis or an inappropriate treatment. Oh, yeah, duplicate patient records. These occur when a patient is registered multiple times in a system, often due to variations in the spelling of names or other identifying information. Duplicate records can fragment patient history and lead to incomplete care. This fragmentation can cause healthcare providers to miss critical information like previous treatments or allergies, potentially leading to harmful medical decisions. Outdated information. This causes problems. EHR systems must be continuously updated to reflect the most current patient information. Outdated information can mislead healthcare providers and affect the quality of care. And for example, if a patient's medication list is not updated to reflect changes in prescriptions, there can be a risk of drug interaction or contraindication. Inconsistent data formats, like different units of measurement or varying terminology, can complicate data interruption and integration. Standardizing data practices is essential to maintain consistency. For example, recording blood pressures in different formats, for instance, mmHg or millimeters of mercury versus kPa or kilopascal, can cause confusion and errors in patient assessment. High-quality data is simply crucial for effective patient care, for accurate reporting and informed decision-making. Poor data quality leads to medical errors, compromised patient safety, and inefficiencies in healthcare delivery. Accurate and comprehensive data enable providers to deliver personalized and timely care, support research and analytics, and ensure compliance with regulatory requirements. Okay, so we've learned that ensuring data quality in EHR systems is vital for providing high-quality patient care and making informed healthcare decisions. By focusing on the accuracy, completeness, consistency, and timeliness, healthcare organizations can improve their EHR data integrity and overall effectiveness. Let's explore strategies for improving data quality in our EHR systems. Okay, maintaining high-quality data in EHR systems is essential for delivering optimal patient care and making informed clinical decisions. And we're going to discuss practical steps for auditing and enhancing data quality, including regular assessments, user training, and implementing checks and balances. These are strategies that will help you ensure that your EHR data remains accurate, complete, consistent, and timely. We need to assess our data quality on an ongoing basis with routine audits using automated tools for benchmarking and reporting our progress and status. Conducting routine audits helps detect inaccuracies and inconsistencies and incomplete data. These audits should be scheduled regularly to systematically review different aspects of the EHR system. For example, periodic checks of patient records can uncover common errors like incorrect medication dosages or missing information, allowing for timely corrections. Automated data quality tools can continuously monitor the EHR system for anomalies and discrepancies. These tools can flag potential issues in real time, enabling immediate action. So, for example, software that scans for duplicate records and inconsistencies in patient demographics can prevent fragmentation of patient history and ensure more cohesive care. Okay, so establish benchmarks for data quality and generate regular reports to track progress. Comparing current data quality metrics against these benchmarks helps identify trends and areas that need improvement. And then share these reports with relevant stakeholders to foster a culture of continuous improvement and accountability. We also need to train our system users, right, to enter data accurately. Develop comprehensive training programs that cover all aspects of EHR use, from initial data entry to advanced functionalities. And this training needs to be role specific, needs to address the unique needs of different healthcare providers and administrative staff. Include modules on common data entry errors, their best practices for documentation, and the importance of data quality. And schedule regular refresher courses to help reinforce these concepts and keep users up to date with any system changes or updates. Interactive and hands-on training sessions are more effective than traditional lecture-based methods. Using simulated scenarios to allow users to practice entering data and navigating the EHR system in a controlled environment can be really helpful. Encourage users to ask questions and provide feedback during training sessions. This interactive approach, it really helps identify knowledge gaps and ensures that training addresses real-world challenges faced by our users. And provide ongoing support through help desks and user manuals and online resources. Ensure that users have easy access to assistance whenever they encounter data entry issues. And establish a super user program where experienced users can guide new staff, sharing tips and best practices for maintaining data quality. Okay, we're going to shift gears. There's somebody else I want you to meet here. Thaddeus Dickson. He's the founder and CEO of Xpio Health. Thad is a self-made tech visionary with a really big heart for behavioral health care. 25 years of experience under his belt, Thad's journey started in case management and counseling, where he cultivated a passion for helping people and organizations thrive. And over the years, he seamlessly combined his love for technology and science with his dedication to improving care quality, particularly in the behavioral healthcare space. At Xpio, Thad has been the driving force behind security and technology initiatives, leading the charge as a trusted CEO for healthcare partners. Armed with certifications from ISC2 and the tech giants Microsoft, AWS, and Google, he's a powerhouse of expertise. And when he's not crafting solutions or evolving Xpio's offerings, you'll find him sharing insights as an author and speaker at the intersection of technology, healthcare, and security. Thad isn't just about the credentials. He's about making a difference, one innovative solution at a time. Please welcome Thaddeus Dickson.
Well, thanks, Brian, for that warm introduction, and thanks, everyone, for being here today. And I think we're in a really exciting time when it comes to the ability to materially impact data quality through some of the technology and tools that are available. And I want to introduce kind of a new word potentially to some of you as it relates to the optimization journey. And that's datafication. And, a lot of us think about implementing an EHR as a real clinical tool that helps you achieve your billing. And while those things may be true, the other thing your electronic health record system is really doing is it's enabling your organization to see your data in new ways. And as we've evolved from our 1.0 paper systems into our 2.0 first generation EHRs, and now into our 3.0 EHRs with advanced tools such as analytics and AI enhancements, I think we're really entering into the dawn of a new age that can materially impact and radically improve the data quality and optimization, as well as the clinical experience of users and the organization as a whole. And so let's come back to that word datafication, because really what we are achieving by implementing a well-optimized EHR is a database full of rich, informative information, with the caveat that it has to actually be pivoted into actionable data. And that is where this word comes into play. And so as you implement that EHR and as you collect that data through your forms and as your clinicians enter in that data and your billing systems amass that data, it's really important to think about how you then pipeline that data into tools that can help you manage quality and manage outcomes and manage the overall organizational objectives. And so as you implement this EHR, I want you to kind of think about what you can do with that data as much as the actual interfaces of the system itself, which are very important. But when you think about really moving the needle on quality, on volume, on the number of patients and clients that you can see with a fixed number of clinicians, I think that it's really important to think about the automation implications that having a complete database full of valuable information can offer your organization. And this construct is really coming into play with the use of AI and its several use cases that Brian mentioned within behavioral health and healthcare. So I'm really excited about the tools that are available through different stacks, be it Microsoft and Copilot, or be it AWS and embedded language models within Redshift, for example, a data warehouse application, and Anthropic's Claude AI tool. These tools offer an unprecedented way to parse, tackle, and illuminate data at scale. And when you look over the last 6 years to 10 years across different industries, you really see a pattern emerging. And that's that the most successful organizations out there have taken their data and have actually leveraged that into advanced AI and algorithms to mine that data for insights that would traditionally take human analysts dozens of years to get the same level of information out of. And so what's really key when we think about optimization, as Traci mentioned, is that not only is it really the first part of a journey, but it's the data collection part of the journey. And now there's a big job for organizations to do. And that's to figure out how to make the most of this data collection tool, your electronic health record system, so that you can truly help impact the quality of lives for the patients you serve and the health of your organization. So Brian, I appreciate you being here today with us. And Traci, thank you. And I'll let you continue.
Thank you, Thad. Well, great insight. Okay, effective checks and balances. These are vital for EHR data integrity. Regular peer reviews and automated validation tools catch errors in real time, while multi-level approvals ensure thorough vetting of critical changes. And these practices enhance data reliability and staff accountability and quality improvement efforts. So implement data validation rules within your EHR system to automatically check for common errors during data entry. These rules can enforce mandatory fields or validate data formats or flag unusual entries. For instance, ensuring that numerical fields like blood pressure or temperature fall within a plausible range can prevent entry errors that would affect patient care. Regular peer reviews can help identify and correct errors that automated tools might miss. Encourage a culture of collaboration where healthcare providers review each other's entries for accuracy and completeness. And set up review teams or committees to oversee this process and provide constructive feedback to improve overall data quality. Establish feedback mechanisms where users can report data quality issues or suggest improvements. This continuous feedback loop can be used to update training programs and adjust data validation rules. And create a system for tracking and addressing reported issues to ensure that feedback leads to actionable improvements. Okay, so we see the need for checks and balances for data quality in EHR systems. This is not a one-time fix, okay? This is an ongoing commitment to excellence through regular assessment and training. And when it's done right, it ensures that your data is working for you, driving better clinical decisions and better patient outcomes. Now let's discuss how we can use our EHR data to drive clinical decisions. We talked about clinical decision support earlier. CDS systems let us leverage EHR data to enhance clinical decision-making. By integrating decision support tools and evidence-based guidelines, healthcare providers can improve patient outcomes and operational efficiency. And in this section, we're going to discuss how to effectively use EHR data for clinical decision support and explore some real-world examples of CDS systems in action. Decision support tools represent a powerful advancement in EHR functionality, integrating clinical guidelines directly into your workflow. These tools can provide real-time guidance while maintaining provider autonomy in decision-making. Keep in mind that implementation and specific features will vary by system, but when available, they can significantly enhance clinical care delivery and practice standardization. Evidence-based medicine. This ensures that we're delivering the most current, proven care approaches. And when integrated into your EHR's decision support tools, it helps to standardize treatment protocols while allowing for individual patient needs. From managing chronic conditions to preventive screenings, these tools help translate research into practice. Data analytics and predictive modeling. Thad was talking about this a little bit. Advanced data analytics can identify patterns and trends in patient data, supporting predictive modeling and risk stratification. And these insights enable proactive care and early intervention for high-risk patients. For instance, predictive models can forecast which patients are at risk for readmission or complications, allowing healthcare providers to take preventive measures. Okay, let's look at 3 ways that clinical decision support improves outcomes. First, real-time medication alerts help prevent errors and adverse interactions. Second, automated preventive care reminders ensure timely screenings and vaccinations. And finally, for chronic disease management, these tools provide evidence-based recommendations tailored to each patient's needs, helping to optimize their care plans. Beyond improving clinical outcomes, clinical decision support systems enhance operational efficiency in 4 key areas. They streamline workflows by automating routine tasks. They facilitate care coordination through shared information access. They optimize resource allocation through risk stratification. And they reduce readmissions by identifying high-risk patients early. And now we've seen how clinical decision support systems, when they're properly implemented, can transform both patient care and operational efficiency. By integrating evidence-based guidelines with real-time analytics, these tools help clinicians make more informed decisions at the point of care. Okay, let's quickly recap the points that we have covered here today. Advanced EHR functionalities. We explored the integration of AI, machine learning, telehealth, clinical decision support, and predictive analytics into EHR systems, and how these features can significantly enhance clinical efficiency and patient care. Data quality improvement. We covered practical steps for auditing and enhancing data quality, including regular assessments, comprehensive user training, implementing checks and balances to ensure data accuracy, completeness, consistency, and timeliness. And clinical decision support. We highlighted how to effectively use EHR data to support clinical decision-making through integration of decision support tools and evidence-based guidelines. Thank you for joining our Learn to Love Your EHR journey today, where we explored how advanced features and data quality can make your system a more capable partner in care delivery. In our next session, we're going to focus on regulatory compliance strategies, patient engagement features, and security best practices. Each of these topics builds on making your EHR work better for you and your patients. And while maintaining compliance and maximizing efficiency, you might just find yourself appreciating your EHR in ways you never expect. Miss Jill, what questions came in while I was carrying on over here?
Well, let me get myself off mute, and then I'd be happy to share this with you.
Welcome to my world.
What strategies help maintain data quality while managing high patient volumes? Thad, do you want to take that one?
Yeah, thanks, Jill, and great question. I think that most organizations out there continue to struggle with being able to adequately staff their clinical organizational infrastructure, and it's a challenge. And so we continuously look at ways to do more with less. And that's also a fundamental principle of scaling and of managing our organizational bottom line. But of course, quality and patient care has to take a front seat while we manage this ongoing paradigm of limited resources. And I think one of the most important new tools we're seeing in having this new AI evolution arrive in behavioral health is some of the clinical tools to actually help enable clinicians to summarize their clinical sessions utilizing AI. And I'll give a shout out to one of our AI partners, Ilios. And Ilios has some really exciting solutions, which I think offer a real unprecedented way to help achieve more with less. So Ilios's AI stack embeds essentially directly into your EHR and, in fact, into your browser. And so it runs as a browser-based application without requiring an additional installation on your desktop. And it really integrates seamlessly with, I'd say, the majority at this point of behavioral healthcare EHR systems. And what the Ilios AI functionality enables clinicians to do is, via a listening device or a telehealth session, the Ilios AI tool will effectively transcribe your clinical session, and it will organize it based on best practices and evidence-based practices into your notes field within your EHR. And it will then transcribe that entire session simultaneously to you, providing the clinical session, if you will, in real time with your client, with your patient. And that then gets put into the notes field in a format that is approved by your organization. And it allows then the clinician to review those notes and to make any modifications or changes necessary before approving that note. And effectively, what this achieves is something we've talked a lot about in the industry, but have had challenges implementing, and that's concurrent documentation. And with that concurrent documentation enabled by an AI summary of the clinical session, clinicians are able to effectively drop the amount of time they spend documenting while maintaining high patient engagement down to really as little as 5 to 10 minutes per session. And so that enables you to complete an hour-long clinical session with just an additional 10 minutes of time to review and to then approve the notes that have been taken automatically while you have been performing that clinical session. And many of us are using these same tools within our Zoom meetings and our Teams meetings, recording our notes, transcribing those notes. But applying that to clinical, I will say, has some caveats. And one of the caveats is that while this can improve your efficiency, and while it arguably can improve the quality, because you are obtaining 100% transcript of the meeting, the way that the AI tools work is they don't actually save that transcript for security reasons. It is temporarily cached, it is summarized, and then once you've approved that note, the recording itself effectively disappears. And so it is not retained long term. And so what this means is that while we have a chance to capture 100% of our content from our clinical session, we do need to guard against the natural human tendency to not thoroughly review that clinical note and session and just simply say, looks good to me, click save, and move on. And so I think within that, there is a new sort of field of training that needs to be considered, and that is training on how to take clinical documentation and notes with an AI-enhanced methodology that still abides by rigorous clinical standards. I think that there is understandably some concern about the level of thoroughness that clinicians will apply to the documentation if AI is simply transcribing that entire session. And so I think that it's really important to apply clinical supervision and audit those notes and ensure that clinicians are thoroughly reviewing and look for increasingly, I'll say, evidence of rigorous clinical interaction within the therapeutic interaction within those clients' charts. And I do think that takes a new type of data quality analysis and a new type of auditing. At the same time, these tools are really transforming the way in which these new services are being, or the way in which services are being delivered with these tools. So I think that it's something that we really are finding is a valuable tool, and it comes with those caveats of needing supervision and data quality analysis to ensure that you remain compliant and don't take shortcuts just because you're utilizing an AI tool.
Thad, thank you for that. Thank you for that. Jill, what else do we have?
What approaches ensure consistent data entry across multiple behavioral health programs?
I'll take that one.
Thank you, Traci.
I think when you're thinking about multiple programs, and also I think this addresses the data quality issue while trying to manage high patient volumes, standardization is one of the keys. So standardizing your data entry so that you are reducing variability in data, reducing the errors. So for example, data that is collected across multiple programs, standardizing that data collection as much as possible is crucial. So identifying the required data that all programs have to collect, and possibly using one template for all of those programs for that required data. Using things in your form configuration like drop-down menus, checkboxes, predefined options, so that you can make sure the data is collected in the same way across all of those programs. Also, I would say ensuring data quality across programs, conducting consistent audits, and automating those processes to help with this where you can. So the analysis and identifying the data quality issues. We talked a little bit about data governance, and I think that's really important when you're looking at multiple programs that may be in multiple locations, having a way to incorporate new data requirements. So you're vetting those requirements, getting them configured in a way that is going to give you the highest likelihood that the data will be collected in the same way across programs. I think training staff regularly, when you have new data requirements that go into effect and you are embedding those in workflows, making sure that you're training staff. Here's the new requirements. Here's the new data collection tool. This is how it needs to be collected. This is the format. And then I think you can also use role-based permissions. So, we've seen some instances where people were granted permission to change forms in different programs, and you may have assigned a person in each program to modify forms, and that then leads to data inconsistency. And so limiting who can modify those forms and making sure they go through your data governance process. So I think those are some high-level things that can be done when you're collecting data across multiple programs.
That's great, Traci. Thank you for that. What else do you have for us, Jill?
How can predictive and analytics be used to improve behavioral health outcomes?
I think this is another exciting and emerging area of where our advanced analytics tools are starting to really impact the way that we can interact with our data and our information within our electronic health record system. There's several different uses of predictive analytics, but I think one of my favorite use cases is looking at how to impact your no-show rates using predictive analytics. And so, for example, with the use of, I'll say, reports analytics as well as AI, we're seeing some interesting use cases emerge where looking at patterns of which days of the week, which times of the day, and which clinicians and which patients have either high or low no-show rates, you can start actually predicting, based on when you schedule an appointment, the likelihood that a client may attend that session. And so with the tools that we have, we're now able to look back over the history of both clinicians as well as a client's attendance rates and start making some good guesses on if a newly scheduled appointment is likely to be kept by that patient. And so if you do take that data we talked about within the datafication framework and you run that through a reporting and analytics and AI tool, you can start actually determining and giving clinicians the ability to determine if the scheduling time slot that they're putting a person into is really the best slot for that person. And so we're looking at now developing a way to put a hypothetical likelihood of attendance rate right into the scheduling system and set that next to the front desk or the clinician themselves so that they can look and say, well, if I schedule this person for 9 a.m. on Monday, it looks like they've only attended 35% of those sessions in the past when they've been scheduled on that day. But if you move that to, say, 11 p.m. on Monday, you might find that that same person has a 73% likelihood of attending. And so these are ways in which we can start leveraging the data that we have, looking at the patterns that have existed historically, and then making some predictions on how in the future those patterns could apply. And these are ways in which we can really start to move the needle on basically improving our organizational efficiency.
Thad, thank you.
I think I'll tag on to that just real quick. I think another exciting thing with predictive analytics is working with social determinants of health. And so analyzing data like living situation, income, employment, access to food, and identifying individuals who are at higher risk for behavioral health challenges, and maybe incorporating those things into your treatment planning to address barriers to care. Early identification of high-risk individuals. And I think doing some risk stratification, for example, with for crisis prevention, like looking at patterns of medication adherence or hospital readmissions to predict patients who are at high risk for crises. So those are some really exciting things relating to predictive analytics as well that can be in the prevention realm, like identifying who might be at risk and then taking some steps to help manage those risks.
Thank you, Traci. Okay, thank you very much. I want to thank everybody for joining us here today, panelists and attendees alike. As we have grown a little bit closer to learning to love our EHRs, please join us for the next session. And thank you so much for being here today.